everybody, thank you so much for joining me here at Beauty Therapy with Absolution. My name is Julia Edgley and I'm a homeopath, and I'm going to be sharing with you my face mapping. It's a technique I adapted from my patients mixed with traditional Chinese medicine, Ayurveda, facial reflexology and just my experience that can show you imbalances that might impact your well-being. Now, it's very important to remember not to mix this up with a medical diagnosis. So what I wanted to talk to you today is about your cheeks. Here, the two sides, and what symptoms I'm looking for when I look at your cheeks. So mostly what I see in patients is acne or rosacea. Okay, now before I go on to talk about what I am asking the patient about, if you have, say for example, acne on one cheek and not the other, don't worry about what I'm talking about. You need to look at what side you talk to your phone on and what side you sleep on, and you need to make sure that your I'm thinking in French, pillowcase is extremely clean. Get a silk pillowcase, and you need to make sure that your phone screen here is really clean. So clean that down with some disinfectant and some natural disinfectants or alcohol every day. So if you have symptoms on one side. Now say you have the symptoms on the two sides, which is what I observe in my patients. What does this indicate for me? Now this is mostly taken from alternative therapies, and that is actually indicating to me an imbalance in the lungs of the body. This is taken mostly from Chinese medicine and facial reflexology. So an imbalance in the lungs, and I often see this with patients who have had asthma or old infections of bronchitis, bronchiolite, and they've had to be on a lot of medication. Now in homeopathy, asthma, hay fever and eczema are the same energy pattern of the same disorders. So actually you can see this a lot in families, and often these teenagers will have acne on these cheeks, but even also in adults. I can also tell straight away if somebody smokes, and this has happened in practice when I have had teenagers and I say an off the cuff remark of, well, at least you don't smoke. And you can see in the teenagers that we can identify the moment that they started to smoke, because you can see it on their cheeks. Now, I'll ask questions such as, did you have asthma? Are you still on asthma? Are you still on medication? Or if you're living in an area where there's a lot of pollution, there's a lot going on in your lungs. So what are you going to do about this? Well, the first thing you want to do is you want to work on your breathing exercises. Now, I work often with a osteopath, and even though we are born with innate ability to breathe, we cannot do it correctly because of lifestyle. So what you're going to do is you're going to re-educate your breathing. And at the end I will talk you through the 4x4x4 breathing exercises that I recommend for everybody. So you want to get in the fresh air, you want to work on your breathing. There are herbs you can take such as burdock, which is fantastic for your lungs and your skin, but also obviously you need to work with a practitioner if you are on certain types of medication. And the other thing that I would recommend as well, that if you are coming with I will always treat what the patient wants me to treat. So if they want me to look at acne, I will start with a standard acne treatment such as homeopathy, changing diets, herbs, but I will observe how the lungs and the breathing changes in the patient to see at what point we need to address this. So before I let you go, I'm going to talk to you about the 4x4x4 breathing that I recommend to all patients, because even though our lungs might be fine, the muscles, we feel that we are breathing fine, the muscles around our lungs are not giving us adequate inhalation deep enough and expiration. Okay, so what I'm going to talk to you through, so the 4x4x4 breathing is you're going to inhale deeply for 4 seconds. You're going to hold your breathing for 4 seconds, and you're going to exhale for 4 seconds. And you're going to do this 4 times. Now the first time you do this, you're going to feel that I can't get enough air in, and that is fine. That is just showing that all the muscles in your upper chest and back are tight. But if you do this every day like a form of meditation, you will exercise your breathing muscles to really detox your lungs. So that is the lungs. Thank you so much for joining me. Stay tuned next time for another series of face mapping.